yes, relapsing polychondritis changed my life, my health, and me, physically and mentally. But it also changed everyone who joined the ride and the race. We've been riding longer than any of us could have imagined. But finding purpose sparked everything. I wanted to hide, and I wanted to suffer out of view of everyone. It is so rare that most people and most doctors have no idea what it is.
There's no way to comprehend the depth of depression and desperation as you watch your lifelong partner fall behind and become someone so different than the person you used to know.
To realize that nobody kind of understood what was going on, it just didn't make sense.
There were some real low points as Nancy went to doctor after doctor. These were world-class organizations, UCLA, Mayo Clinic.
It is very frustrating to not have the knowledge or the testing available.
I had once lived an active and healthy lifestyle, but eventually I just about gave up as I struggled to get through the day without pain.
A person who has been fit all her life, whether it was running, swimming, volleyball, hiking, biking, you name it, to having trouble going up the stairs in the house.
The physical embodiment of the disease was really starting to show.
And the endless list of possible diagnoses was thoroughly explored, one by one, ruled out.
Just like we don't understand what triggers the illness, we do not understand the underlying cause.
It's such a limited set of folks that have encountered the disease. The outcomes are not positive.
I think it's fair to say that the average doctor will never, ever see a case.
One of the hardest parts was discovering that no one believed that I really didn't know what was wrong with me.
It was incredibly frustrating to not be able to help Nancy. She was wonderful with regard to sharing what she learned, but to be blunt, she wasn't learning much.
This can be a life-threatening illness and poses extraordinary treatment challenges for both the physician and the patient. Triggers are not well known. Oftentimes these things occur rather acutely and without much warning.
It was a real dose of reality quickly.
I really thought that her time was limited.
When you come home and realize that it's uncertainty that could be the proverbial life and death here, it's a whole different thing.
Before we knew what RP was, the finish line was finding a cure for the mysterious chronic illness. Along the way, it became my family's struggle to help me, my friends' wish to support me, and then a community campaign to find answers for the many other people with autoimmune diseases and relapsing polychondritis. Shifting focus and embracing life with a fresh purpose was not always easy. To bring awareness and people together for this ride and race needed sacrifice. My privacy, which I always guarded closely, was given up. My medical records would be shared with strangers, and my personal struggles and pain made public. In this all-or-nothing race, we navigated the challenges around each bend and up every steep climb together. It was no longer about me.
As I look back, I remember it being as early as 2009. When Nancy was experiencing extreme discomfort and confusion around this sort of mystery illness. Autoimmune diseases are discrete. They're not visible like other diseases are on the outside, and a lot of people are suffering silently.
For me, what got my attention was my sister and my relationship with her. She was always very caring and very giving, growing up, and she had a philosophy that life is not a dress rehearsal, and this was long before she was diagnosed. And a great mentor, more than a cheerleader. She just always had a way of bonding with every member in the family, but quite frankly, we've seen family and friends. And so it was a unique opportunity to essentially give something back to someone I cared for who never asked for anything.
When we discovered Nancy's diagnosis of relapsing polychondritis, we were told it was a very rare disease, maybe 2 to 3 people per million. But it's not rare if you have it. It's like an economist's definition of a economic slowdown or a recession. It's a slowdown if your neighbor is out of work, but it's a recession if you're out of work. So in this case, clearly it hit us right between the eyes, but we really had no plan other than when you first looked at existing research into relapsing polychondritis, it dated back to the early 1930s.
When we first talked about it, or I first heard about what Neil and Nancy were doing, I sort of had an idea of what they were up against. When you have orphan diseases, it means not a lot of people are involved. You got to go out there and find key folks who will listen to you. You have to find docs who have a reputation for being willing to care for patients with these rare diseases. Also people who aren't afraid to speak their mind, bang the drum, let people know that there's some important information here. You need to hear about this. You need to support this. This could be you. This could be your family member or your neighbor. For Nancy and Neil, they had to exhibit an awful lot of courage because, right, you're all of a sudden sharing this very private story, which is nobody's business but your own and your family's, and finding doctors who would listen and support the work. I knew they had a long hill to climb, or big hill to climb.
My story isn't mine alone. It's intertwined with the stories of those I love, the stories of those who struggle with the same illness, and the stories being written by those who are researching autoimmunity and RP to find answers.
Once she was diagnosed, it was very easy, certainly for me, to say, we have to do something. I had to start from scratch. I didn't know that lupus was an autoimmune disease, or rheumatoid arthritis, or psoriasis, or any number of these diseases that we hear about in our daily lives, but we don't necessarily put them in that autoimmune disease category, and we don't link them. It was not difficult to realize that we probably needed to start with awareness.
The challenge of rare diseases is people haven't heard of them. They don't understand the magnitude of the problem they can cause until it's one of you or one in your family.
I think a lot of people struggle with undiagnosed autoimmune diseases. I think that going back to, the idea that so many patients are expressing and communicating ailments that aren't necessarily fitting into a perfect little box. And I think as a result of that, I think we're now within a community of people, this, autoimmune diseases, in which people are less inclined to speak out. They're less inclined to, go on that journey and make that hike because they don't feel supported.
When Nancy's diagnosis came to pass, Nancy said she has a purpose. And, that purpose involved a number of us. And, as I said, it became very clear what our path was going to be. So, it's funny how life works, because it put a number of people in the room that knew what had to be done. And fortunately, I like to say that the autoimmune world is fortunate to have a Nancy Lynn get diagnosed with an autoimmune disease.
I think the most important decision was to take action. And Nancy decided that she was going to take action and create RP, The Ride of My Life.
RP, The Ride of My Life. Put it all on film in a way that we're going to build awareness and educate with respect to autoimmune diseases. It affects about 3 to 5 people per million. It's an autoimmune disease known for its ability to trick the human body into a relentless attack on its own cartilage. But we can try and advocate and educate and build awareness, and that's what tonight is all about.
We don't have all the answers, but we have purpose. And having purpose changes everything.
At the time, I don't think we knew what was coming in front of us other than there had to be a way to first raise awareness of autoimmune disease in general, specifically for relapsing polychondritis. We had to educate people that 1 in 5 Americans suffer from autoimmune disease, yet autoimmunity doesn't seem to acquire the assets.
We also realized, since we were starting from scratch, we had to figure out who's doing what. So who are the key players? What are they doing? We also knew we had to punch above our weight class in the context that we had to collaborate.
Thank you, all of you, for being here today. This is bound by a common thread, and I think given ARDA's mission, it's completely and totally appropriate. There are 50 million Americans who suffer from autoimmune diseases, and ARDA is the only organization in the nation that is dedicated to the eradication of those diseases. So it's the folks who are at this table, who work every day, on behalf of the mission, who support the patients. It's the patients who are here. So I want to thank you from the bottom of my heart for being here.
The American Autoimmune-Related Diseases Association, also known as ARDA, is a national voluntary health agency. We advocate for patients with autoimmune disease. We know that the average person in the population doesn't necessarily understand autoimmune disease encompasses over 100 diseases. They may know many of the diseases, like lupus or type 1 diabetes or MS, but they won't know about diseases like relapsing polychondritis. But we know the average patient spends 3 years, sees 3.5 doctors, and over 50% of women with autoimmune diseases have been told that they're chronic complainers or they're too concerned with their health. They go from doctor to doctor trying to find out what's the matter. They have very significant symptoms, life-altering symptoms, but they're dismissed.
We did do an event with ARDA, and I thought it was great. There were hundreds of people there. It was well attended. But I turned to Nancy and I said to her, I said, how do you feel? And she was happy. She was happy for the same reason I was happy. But she wasn't as happy as I expected. There was something else, and I wanted to find out what it was. And I said, Nancy, what would make you really happy? So in the middle of these hundreds of people with a live band and first class event, she said, research. She said, I want them to research this disease so other people don't have to suffer. And they have treatment options and care options. And that's so basic, but it was so important for me to hear it, from her, to hear it from a patient.
So why not start at the top, in a sense, a government-funded agency, National Institutes of Health. And Nancy made some contacts there with the help of her brother, Mike Lynn. Once again, opening herself up to examination, to making her bad news available for others, hopefully turning it into something that would, again, not only result in more research, but in the long run, perhaps a cure. And we discovered not only might this be a good avenue in which to start, but there was a physician there who herself suffered from relapsing polychondritis.
I came to work to NIH in 2010 to do my critical care fellowship and my infectious diseases fellowship. And then I was diagnosed with relapsing polychondritis. So I decided to go back and do a rheumatology fellowship. In my case, it helps because I know what the patients are feeling. I know what they're going through. So I think that is a different connection that you get with the patients. It means a lot to have an understanding of the disease, to have the connection with other patients with relapsing polychondritis, and to see all the things that we have been able to achieve in the past 5 years, which is, I think, a lot for a disease that is rare.
We are currently treating relapsing polychondritis from a multimodal approach. So we rely on many different specialists that are involved in the care of these patients. It sort of takes a village to care for patients with complex diseases. From a medical standpoint, we are constantly looking for new treatments and trying different therapies and trying to understand which ones are more or less effective. And we're trying to, in parallel, figure out what is the best way to follow disease activity, to determine what's going on with the patient. We need those tools in place. Once we have that in place, then we can get to the next phase of what we want to do, which is to do randomized controlled trials where we're formally testing specific medications in a controlled setting.
Patients come here to participate in any research project. They are not only getting help from understanding of the disease and different tests that they will get, but they will be helping other patients by providing all their information and their clinical history and the time that they spend here.
I think the most important thing that we do and the thing that makes us feel the best is to actually bring patients in and let them know that we're hearing what they're saying. That's really our primary role, is to validate the things that they've been struggling with and to reflect back that we understand that. And part of that understanding comes from the fact that we've dedicated our careers to studying these specific diseases. And so we have gathered stories from hundreds of patients that have come through our program. And we're trying to look for as many inputs as we can, as many data points as we can, as many ways to see these diseases in novel ways and traditional ways, and to put those pieces together to make insights that will lead to these serendipitous observations that ultimately fuel discovery. Our major goal for relapsing polychondritis is to fuel collaborative research across the world. We start to make some observations. We start to have success at the research level. We start to promote the disease, and we start to get other doctors and investigators from around the world more invested. We start to partner with groups like the RP Foundation and create awareness for the disease. And that really is the groundswell of support that's needed to make major progress in these diseases. We need investigators from around the world working together to study the disease.
When I was introduced to ARDA made it clear that one of their lifelong goals was to start an autoimmune disease center. And long before my time, I think they came pretty close in creating something in Florida, but for a variety of reasons, it didn't happen. And one day, I was at my day job and I got a call from the executive director, at ARDA. Her enthusiasm was such that I wasn't sure which organization she named. It turns out it was the Allegheny Health Network Autoimmunity Institute. And all I heard was Pennsylvania and Autoimmunity Center. And I said, that's fantastic. I'm extremely interested. We should definitely collaborate.
The whole concept of the Autoimmunity Institute and then our Lupus Center is, number one, to bring state-of-the-art clinicians. And then we also offer research. So we conduct trials of new drug therapies. We're looking at new diagnostic tests to make it easier. It is very difficult to get 17 different specialists to practice under one roof, to focus on just autoimmunity.
Yeah, the benefit of having all of these specialists in one place is the patient is coming to a one-stop shop. Right? They're not going to 10 different places to see 10 different people and 10 people who aren't even talking to each other. The 10 people are here and everyone knows everything about this patient.
A lot of the patients we see will often come from across the country or in some cases across the world, and we may be their 3rd, 10th, 20th stop on their journey, just trying to get something as seemingly simple as a diagnosis or a better way to manage their disease. We're going to achieve that through multidisciplinary, multi-specialty research aimed at finding better ways to diagnose patients, better ways to treat patients, better ways to just improve the quality of lives of our patients.
For the longest time, physicians have focused on treating the disease only. At the Autoimmunity Institute, we have realized with our learning with the Medicine Institute, heart failure, COPD, and diabetes models, that approach may not be enough. The question needs to change. The question that we're asking our patients about, for example, how is your rheumatoid arthritis or how is your Crohn's today? That question needs to change to how are you doing, Mrs. Jones? How is your overall health? What are your needs? What are your anticipated barriers to your health care? And how can we address them and how can we help them?
So we do research because it's our responsibility. As science evolves, we really need to evolve with it and provide better treatments to our patients. We want to cure these diseases for sure, but until then, we have to at least provide better treatments. There are some diseases where we have no options at all for patients. We need to do better.
There's so much collaboration. There's such a collaborative spirit. And even for one research study where maybe you have one principal investigator, there's so many other people here on a day-to-day basis that are involved in that effort, so that when we do see these advances that we are discovering, when we do see patients improving and getting those answers that they're looking for, it's nice to be able to celebrate that with all of our colleagues and with our team here.
What I'm doing matters, and I really want to see people improve through what I'm doing at the bench every single day. It's really exciting. It really is what drives me and gives me passion to get up every day and move my team and motivate us to discover new things that could possibly impact patient care.
The patient leaves, they have this enormous smile, like they've finally been heard, they finally have a plan of action, and to have research be part of that plan, I think feels really good to the patient as well, because they feel they're doing something for the next generation or even the next patients who walk through our doors.
We always say it's the most gratifying thing is for a patient to come and say, you know, I've been looking for years. I have never found a site like this, or people are finally listening to me. You're taking care of more than my disease. I mean, anytime you get that immediate feedback that we've changed their lives, there's nothing better. And that's what gets us up in the morning. We love the Relapsing Polychondritis Foundation and the Race for RP. Nancy, who has this rare autoimmune disease called relapsing polychondritis, where the immune system targets, of all things, cartilage. It's rare, but it's an important autoimmune disease, and it's a part of what we would like to focus on even more here at the Autoimmunity Institute, to provide people a place to go, because not many doctors even know about it or know how to treat it or even to recognize it.
So one of the interesting milestones that we had as an RP Foundation is we went and we visited the University of Michigan's Department of Rheumatology. And for the first time, they started to sketch a program where they could provide care and do research. And to me, that was incredible, because they have an extraordinary reputation in a bunch of areas, including rheumatoid arthritis. So the key became, okay, it can be done.
With most autoimmune diseases, and certainly the rare ones, like relapsing polychondritis, it's diagnosis by process of elimination, knowing what you don't have, but very difficult to get to the what you do have. We had to put relapsing polychondritis in the same arena as celiac disease and other autoimmune diseases. We had to make sure that relapsing polychondritis was a known entity.
How do we get an RP center up and running as soon as possible and be efficient? And what we learned is that Dr. Peter Grayson had been working with Dr. Peter Merkel, and Dr. Merkel is running the vasculitis center at University of Pennsylvania. Dr. Grayson is leading some key research at NIH, and they collaborate. They will share patients and share data. And when we realized that they were working so closely together, and that some of the people at Penn were trained at NIH, our view was, okay, who should we know at Penn? And Dr. Grayson said early on, well, you should know Dr. Peter Merkel.
The Penn Relapsing Polychondritis Program is a program that allows patients to come and get a full evaluation for their disease by rheumatology and by other subspecialists as needed, ophthalmology, ear, nose, and throat, pulmonary, etc., to comprehensively look at your entire case and with you come together with a treatment plan, an evaluation plan. Additionally, it's a research center. We collect data on patients, with patients, by patients, and so it's combining clinical care and research in order to make patients' lives better and understand this disease better.
I think it's hard when patients come into a center and they say they have RP and people kind of scratch their head and they have no idea what it is. But when people come here, they see providers who know the disease, we're familiar with it, we know how it impacts patients, we know what the disease manifestations are.
Even among our autoimmune diseases is one of the more challenging diagnoses to make. It really requires an astute physician to really hone in and think about it and ask very pointed questions. There's not a lot of data out there on the best treatments for relapsing polychondritis. That's what our center is hoping to change. We want to be able to form a center where we have a large enough number of patients where we can more systematically study this and understand what treatments work and what doesn't.
Currently, we are doing a systematic review of literature where we are collecting data on the different types of treatment that has been used so far. This information will help us to develop a clinical trial in future.
So we're learning more about it, but we don't know everything. We don't have standard of care treatments for these patients. And so the research that we're doing is helping us to learn more about the disease and then develop effective therapies.
Because rare diseases are their own sort of experiment, and you can understand what makes that disease tick, what makes that happen. You may find, well, that's interesting. We're seeing a similar signal in diabetes or in high blood pressure. We learn those signals. It goes the other way too. You learn something from a common disease, we may borrow that and say, hey, why don't we look at that in RP? The reason many rare diseases are studied is not just because they're interesting and because the patients need therapies, all of which is true, but because they're a good way to learn about medical science, and that can translate into other discoveries.
To move forward our understanding of relapsing polychondritis, we really need patients with RP to engage in research. All of their individual stories help teach us more about the disease and also help us to understand what are the needs and what are the treatments that work and don't work.
This is a very complex disease, involves multiple organ systems, requires multiple specialties, and the disease being rare, it makes it more challenging. The patients who are affected by this disease, they're really affected. Their life is affected. They can't live a normal life. And a lot of people with airway involvement, lung involvement, they have tracheostomy, that like a significant morbidity is associated with the disease.
Our goal is to try to give them their life back so that they can do all the things that they want to do, so that this is something where, their disease does not define them, but it's a part of their life, but it doesn't define what they can do and what they can't do.
Research is, again, what makes medicine move forward. Everything that your doctors are doing is often guided by research studies. And that could include things that were done in a laboratory as well as research involving human beings, clinical research. A lot of that work does take a lot of time and it takes a lot of resources. And so getting funding is so critical.
Research is expensive. I think people don't always recognize that. There is a lot that goes into building the infrastructure for research. There's coordinator time, there's provider time, equipment that we need to collect blood and to analyze data. And it's just unfortunately not possible without the dollars that go to support that.
The partnership with the Relapsing Polychondritis Foundation has been crucial to our growth. They just have this burning dedication to make this a disease that is treated better and the lives of patients better. And that dedication and enthusiasm is infectious. These are people who are dedicated to helping people with relapsing polychondritis have a better journey and have hope for better treatments and a cure in the future. And it's great to be part of that family.
It's almost a chicken and the egg, what came first. I grew up in Southern California, so I always had an interest in cars, starting even, drive through at the In-N-Out Burger. As I grew older and as luck would have it, we had the opportunity to experience some faster cars with more horsepower and venture into the automotive racing community. I began to learn what the capabilities were of some of the automobiles I owned, and also tried to build my own abilities to drive these cars in a way that I got more out of them. I gradually became more at home and comfortable in the cars, such that an opportunity came to me that I could experience them on a racetrack. And my goodness, I mean, it was unleashing a passion that I didn't know that I really had. The writing was on the wall. I made the decision to retire from a lifelong occupation that I really enjoyed. But the racing season began, and everything else was left in the rearview mirror. My racing so-called career expanded, and we're spending more time at the track, meeting new people. We would see how the racing world really worked. The glory and excitement that you see on TV is wonderful, but at the level from which we started, it was kind of a grinded out guerrilla warfare sort of thing. You know, we see people wearing baseball caps. Well, wouldn't it be cool if we had caps that had our slogan on them? Well, okay, so what would be catchy to go from the ride for RP? Well, we're racing now, so why not the race for RP?
It started off, we had a couple hats. And we realized that as we went to different tracks, that some of these, team owners were, looking down off the pit box and recognizing our hat. And I think at the time we had 6 of them or 12 of them. And we said, oh, okay, these work. People identify you as a team. And so we found, being present will prompt questions.
We adopted the same livery and colors that I've used on my racing car for my recent past, and printed up shirts and hats and decals and bracelets and you name it, any kind of trinket that we could put our label on, and came to the racetrack each weekend with bags and boxes and started handing them out. And how else to build awareness?
So when some of these sports car drivers, taught us, how to use social media and video, that was, very important. It was extraordinary. But they went a step further. They called and they said, hey, I can put Race for RP on my suit. I'll gladly wear your hat. I may be able to get it on a car. So we thought, well, that's great. That helps our cause. Clearly that's awareness, and it's televised, and motorsports is a global sport, but a smaller community. And what we found is a lot of the coaches are professional drivers. So you can see them at an amateur race when they're coaching your brother-in-law or your friend. But then next weekend, they're on a major network, and not only are they winning races, but they're sharing your story, and they made it available for us to put other people's decals on the car.
I was driving for Scuderia Corsa in the IMSA WeatherTech Championship. And I was assigned to Neil Langberg to coach him in the Ferrari Challenge. What stood out to me in the beginning was Nancy's attitude, her persona. She was just so positive, always had a smile on her face, always, wanting to give out hugs. But then to really understand that she's managing a rare autoimmune disease that is life-threatening, that's a big deal. I said to myself, I didn't get to where I am, a professional level of motorsport on my own. I had a lot of help. We've got a platform, we've got some exposure, we've got an audience. I wanted to give back, and I wanted to do something for Nancy, but also for the community of relapsing polychondritis patients and the community of autoimmune disease patients. You'll now see Race for RP on a race car or a driver helmet in just about every race paddock in North America, which is amazing.
Your winning team of 14, Lexus. Let them hear it, ladies and gentlemen. Your winners here in GT Daytona.
This is a body that is going to be able to assist us with getting our awareness of the disease out there. But I think the big surprise was how willing and how broad the desire to help was. We'll show up at a paddock and someone will have a Race for RP hat on. And honestly, we may not know who that person is or how they got that hat. It's an entity that's known on just about every paddock across the nation right now, and actually internationally. So, it has been a brand that has been embraced by the entire motorsports world. And, we couldn't be more grateful to have that kind of support.
The motorsport community is a really small community, no matter what you're racing in. It was a really good way to just kind of spread it throughout by word of mouth. because we all talked to drivers from all different series. That just kind of, I think, formed the, wait, what is that? And who are they? And oh yes, we're on board, definitely. And you see it everywhere. And it's weird, even in my travels, people like in Europe, if I'm racing and I don't even really know that person, and I've seen a person wearing the hat, and I'm just thinking, oh my God, that's so great that it's reaching other continents at this point.
It takes a team, it takes support, and without either of those, nothing happens, nothing moves forward. You really have to have a group of people who are each thinking in their own way to move things forward, but then all those people have to come together and sort of decide what direction they're going to go. And again, that's one of the benefits now. We have 3 different research projects going, but potentially it could be a big breakthrough for RP patients or even other autoimmune disorders out there.
To have brand ambassadors, race car drivers that at the drop of a hat get on an airplane and they're racing around the globe, and people will say, what's that about? We don't know about what RP is. We don't know about relapsing polychondritis. We don't know about autoimmune disease. And they're perfectly willing to take them aside and spend a few minutes and explain to them what it is we're driving for.
The parallels of the racing community being one big family, trying to get that one fraction of a second more out of a car and working together as a team to make that happen. Paralleled with work in a lab where whether you have a lab assistant or a lead researcher trying to get that one last genetic piece of data to help diagnose a patient. The parallels are uncanny.
Social media has a way of bringing people together, much like Nancy. And Race for RP has promoted people with relapsing polychondritis and other autoimmune diseases and created a network in which, patients see themselves. Everyone has a shared story. Everyone has firsthand experience, but we need to add legitimacy to those experiences and allow people a platform to openly discuss and connect.
I give a lot of the credit, if not all the credit, for social media success to those race car drivers, because they helped us bridge our RP message, autoimmune disease message, with motorsports. But it also brought us closer to the patients at different levels. So I remember some patients who had no interest in motorsports, but now all of a sudden it's like, that's my car. That's my driver. And, to have this obscure disease that nobody knows about in your neighborhood, and now you can say, oh, you haven't heard of it? Well, if you turn on, NBC or CBS, or you watch the 24 Hours of Daytona, or you watch this fantastic 12 Hours of Sebring or Mid-Ohio race, that's our car.
So there is the 53 battling away. That's Langberg. I believe he's going to be 70 years old this year. And it's an amazing, and you may have noticed, some of you watching, it has on the side of the car, Race for RP, and that's relapsing polychondritis. That's quite a mouthful to say, but it's a rare autoimmune disease that attacks the cartilage in your body, and they're obviously trying to raise awareness and, more importantly, money to support this great cause.
I was actually very excited when I saw Race for RP. I was a big motorsport fan when I was a kid, so if it gets people thinking about what is RP and just the money that it raises, the awareness, I am grateful. As I say, I think it's rare within a rare disease.
Having Race for RP in my corner and everyone that has relapsing polychondritis in their corner is wonderful. I mean, I share it on my Facebook page all the time because you can donate. It tells people what it's about. It gives us all hope that they're doing something.
What better way to spread it than to put the logo on a car where hundreds of thousands of people watch these races? Okay, you're going to ask what's Race for RP, and there you go. You just shared it with one person. You made them aware, and they're going to go tell their family, and they're going to tell the people they work with. And now you've spread the awareness to a whole new group of people. And my daughter's like, her friends in Texas, like they live in this little remote area in Texas, and she has the t-shirts and the bracelets, and the grandkids have them, and the grandkids understand that Nona's sick, and, sometimes Nona can't play the way they want me to, but, if you can just get one person to listen and you can spread that and that person tells somebody else, like there's so much more awareness now than there was even like 5 years ago. There's no other thing out there other than social media that can bring global awareness the way Race for RP does.
All they want is to be recognized and to realize that there's a group larger than themselves out there really trying to educate, to draw awareness to their plight, and to expand and renew the vigor that's needed in the medical community to do more research.
We are now aware that there is a very close link between autoimmune diseases like RP and cancer, diseases of the bone marrow. We know that both the diseases have what we call genetic reason, underlying genetic abnormality that is causing this. We know patients with RP go on to develop these cancers, and patients with cancers who we had no idea had an underlying autoimmune disease. When we are studying them, we can see all that evidence of the underlying autoimmune or inflammation in the bone marrow when I see that through the microscope. It's like a window of opportunity that I see once we pass through this tunnel. It's going to open up into a big landscape, and it will have impact not only for RP patients, but with RP patients and other autoimmune diseases and patients with cancer. I'm very grateful to the RP Foundation because it's recognized the niche, right? It's recognized the relationship between the autoimmune disorder and cancer, and it is providing us this innovative and the right environment to foster our ideas. The interest is beyond RP now. It's to a much larger population base, and they're bringing in great institutions together, experts from multiple institutions. I think that's just the right way to go.
We identify the cause of a subset of patients with autoimmune diseases as a genetic mutation. And the reason why this is exciting is because it gives us a target, a pinpoint, how to treat patients and how to diagnose them. So UBA1 mutations cause VEXAS, and VEXAS stands for vacuoles E1 X-linked autoinflammatory syndrome. And a lot of the patients with VEXAS syndrome actually carry relapsing polychondritis diagnoses. And what we found is that UBA1 mutations can be the cause of many different autoimmune diseases. So although patients might have different manifestations, they have the same root cause, which is this UBA1 mutation. And why that's important is that we as a community of physicians need to think about treating patients based on the cause, not just the symptom, because we're going to stop the disease by stopping it at the starting point. So the RP community should be excited about VEXAS syndrome and UBA1 mutations because it's an opportunity to study what causes at least a subset of chondritis. It's the first time we know why patients can get inflammation in their cartilage. And although that might not be the case in every individual who has inflammation in the cartilage or relapsing polychondritis, it still might hint at why they have that inflammation, what the process is that causes these symptoms. So the Relapsing Polychondritis Foundation has helped form and support the collaboration between myself and MD Anderson, and so that we can help identify patients who have UBA1 mutations so that we can hopefully get them the effective treatments that they need, and also identify new driver mutations so we can continue this cycle of finding new genetic causes and finding the appropriate treatments for patients.
We really set up two buckets when we looked at creating where we are today with the foundation and Race for RP. So Race for RP is wholly responsible for the awareness campaign, and it is donor directed for funding the Race for RP piece of our awareness. But what that awareness piece has allowed us to do, both on the social platforms as well as at the track and elsewhere, is it has allowed us to cultivate an audience of givers. So we've been able to take the awareness campaign and educate patients and physicians and the medical community on relapsing polychondritis. But we've also been able to use our social presence to educate the philanthropic community to support autoimmune disease research.
For diseases like RP, in which there's just not a lot of information to begin with, it can be an extra hurdle to get funding. Having a foundation like the RP Foundation that's really focused on RP and wants to support RP research, I think is going to, open up a whole lot of doors and opportunities.
Research funding is hard. Many of the advances happen through a combination of private philanthropy, institutional support, and government funding. You just can't get certain types of programs run by grants alone. Think about this. If you're a drug company, where are you generally going to invest? You're probably going to invest your resources in more common diseases because, honestly, you can sell more drug, and they cost them zillions of dollars to develop these drugs. We certainly get drugs developed in rare diseases, but it's not always the first place they look. But what if we have more of an infrastructure and we say, look, we've come halfway. Can you let us use your medication? Let us go together. We'll partner and go forward. We can do more.
Every dollar counts. There's so much opportunity to do a better job on behalf of our patients. If you have a heart and an interest in RP, whatever you can give makes a big difference.
The Race for RP program, it's awareness, it's fundraising, and it's getting us in touch with people who may be able to help us, help the RP Foundation and our patients and our scientific community grow and thrive.
Without fail, it's very rare to have a race weekend without a yellow flag or, heaven forbid, a red flag. Cars on the track will regroup behind the safety car until the incident has cleared from the track, and then we have a restart. And that's the sign that we can go back to racing full on, full speed. Both Nancy and I have had restarts in our personal lives. In Nancy's case, it's the discovery of her diagnosis of a rare autoimmune disease. In my own case, this time last year, a brush with a weak form of blood cancer. But we get the quality, the resourcefulness of get back on track, get the restart going, and get back in the race. Because the race doesn't stop.
People have come up and asked me about my issues because I've never told anybody. Even my brother didn't know until yesterday. I didn't want to tell him, but I've kind of opened up and I'm sharing my story. I'm sharing my story with you. What Nancy has been able to do, she singularly has brought so much awareness. And the one thing about Racing for RP is they support all autoimmune diseases, not just RP.
It's the difference between, I guess, being considered a black sheep and then finding a group of sheep that are similar. Oh, come over here. We're good. We can help. And it feels a bit like that. It's like being lost and like, am I going to have to try and deal with this on my own?
Really like to thank the Relapsing Polychondritis Foundation. They have been huge in my life since I've gotten this disease, relapsing polychondritis. I don't know where I would be without their support. Not only with getting the right medical attention, but their motivation to lift my spirits, to be there for me. With all the help I've received from the foundation, I want to help others as well. And if I can do something to make other people's lives better that are suffering with this disease, I'm all for that, and I will do that.
I want to use the time that I have. I want to spread awareness. Like, there has got to be more. If you can just get your word out to one person and that person can spread it, it's just awesome that the research that they're doing now that wasn't there like 10 years ago. Without hope, you have nothing. Without hope, the disease wins, and I'm not going to let it win. It's not going to win with me.
Taking what would have been one of our greatest defeats in our lives and turning it to a positive, not only for ourselves, but for the autoimmune community in general, and get going with it, make it into a bigger positive than just what we can do on our own, but to harness the resources that are out there in the medical research community and turn it to not a defeat, but a very positive development for ourselves and others.
What this means is that all of the work has mattered and that it's counted, but it can't continue to go on unless it's fully funded and supported by the medical community and by private individuals, organizations, companies. We need a constant stream of revenue to hire the best in the industry, to hire the people that are passionate, the people that are hungry, to do the research, and to put in the work.
If we figure out RP, the dominoes will fall. And for this type of community coming together, if we can work together and figure out RP, we'll figure out lupus, RA, MS. The pieces of the puzzle will fit in the other puzzles.
We look at it as, hey, we want to get this as far down the path as we can, have other family, friends, other motorsports people, carry the ball, other researchers. So to pass the baton, we want to pass it the patient groups, we want to pass it in the researchers, we want to do it in motorsports, and we want to broaden it. We want to entice folks, pharma companies, National Institute of Health. We want them to be doing this work and to not even know that we had to do what we had to do. And sometimes we see that. We go to a racetrack and we'll see someone unload a car. It's got our logo on it. We've never met them. We can go, to some research places and they'll name names and we're like, wow, that's great. So we definitely, we want to put ourselves out of business.
Get it right the first time. It's not a dress rehearsal. Do it more, do it sooner. Do it with the utmost vigor and energy that you can harness. Do what you can for the people you not only work with today, but the assets and the resources that you leave for those that come after you.
So how far have we come in these 10 years? Of the many lessons learned, the foremost has been that purpose is powerful. Purpose, even when originating from pain, can bring people together to create change. And we are determined to change the outcome for autoimmune and RP patients with your help. Our purpose is greater than one person, one family, one passion. It's a race that needs to continue building a network of supporters so that as we round another turn on the track, the next person might be the one who helps us cross the finish line. Join us on this ride race. Our team is growing. But there is room for you.
Not chosen the path I walk. Journey is lonely, yet everyone can watch. Help me, give me strength when I lose sight. One foot and then the other, push, push. I'm not backing down. Never surrender. The fight that turns you into a champion. Keep moving forward. You fight the fight and keep your I will fight doubt. Days filled with questions I couldn't figure out. Strong